The cytoskeleton is a series of intracellular proteins that help a cell with shape, support, and movement. Cytoskeleton has three main structural components: microfilaments, intermediate filaments, and microtubules. The cytoskeleton mediates movement by helping the cell move in its environment and mediating the movement of the cell's components. Microfilaments are the smallest components of cytoskeleton at about 7 nanometers in diameter. They are composed of V-actin protein and are round in a helical shape. Intermediate filaments are 8 to 12 nanometers in diameter and are twisted together in a cord shape. They are composed of keratin and keratin-like proteins. These filaments are tough and resist tension. Both microfilaments and intermediate filaments help in support and shape. Microtubules are composed of alpha and beta tubulin that form long, hollow cylinders. These are fairly strong proteins and are the largest components of cytoskeleton at 25 nanometers. Tubular monomers can be lengthened or shortened from the positive end. They have a function in change of shape and movement. They have three different functions. They make up the centrioles in a cell, the flagella and cilia of a cell, and they serve as tracks for transport vesicle to move along. Cytoskeleton rearrangements occur in physiological events such as cell movement. Cytoskeletal defects are frequently associated with diseases.
This is a neurodegenerative disease which does not yet have a cure and the exact cause is not yet known, but they are working on it. We are now going to talk about the main characteristics of the disease. The neuronal cytoskeleton is a complex structure responsive to both intrinsic and extrinsic factors. Defined populations of neurons in the brains of patients with Alzheimer's and several other neurodegenerative diseases contain abnormal filamentous accumulations which share elements with the cytoskeleton. Although there is a general consensus that these abnormal filaments do contain cytoskeletal elements, that much debate remains regarding which cytoskeletal elements are incorporated and whether the cytoskeletal rearrangement is primary or secondary to other cellular changes. They also think that the patients who have Alzheimer's may have a huge accumulation of LD beta amyloid proteins compared with patients who have a normal cognitive level. There are a few characteristics that will increase the risk of getting AD, and those are being old, have a close relative with AD, have certain genes linked to AD, and also having heart and blood vessels problems due to, for example, high cholesterol and history of head trauma. We can distinguish between two types: the early onset AD symptoms appear before age 60. This type is much less common than the late onset. It tends to get worse quickly. Early onset disease can run in families, and several genes have been identified. In the late onset AD, this is the most common type. It occurs in people aged 60 and older. It might run in some families, but the role of the genes is less clear. And finally, mild cognitive impairment is the stage between normal forgetfulness due to aging and the development of AD. Not everyone who has MCI will develop AD. Some of the main symptoms include difficulties in memory, thinking, and behavior.
Schizophrenia is a mental disorder often characterized by abnormal behavior and failure to distinguish reality. Most cases of schizophrenia appear in late adolescence or early adulthood. However, it can also emerge during childhood. Individuals with schizophrenia may experience hallucinations, like hearing voices, suicidal thoughts, delusions such as false beliefs of persecutions, disorganized thinking and speech, loss of motivation, paranoia, social isolation, difficulties in working and long-term memory, signs of catatonia like remaining motionless, psychosis, inability to experience pleasure, and lack of desire and emotion. Several factors are generally involved in the contribution to the onset of schizophrenia. This illness has a strong hereditary component. Individuals with a parent or sibling who has schizophrenia have a 10% chance of developing the disorder, as opposed to the 1% chance of the general population. Although there is yet no definite proof, many experts suspect that prenatal or perinatal trauma and viral infections may contribute to the development of the disease. Plus, drugs like cannabis and LSD are known to cause schizophrenia relapses. In addition, abnormalities in brain structure may also play a role in schizophrenia. Enlarged brain ventricles are seen in some schizophrenics, indicating a deficit in the volume of brain tissue. There is also evidence of abnormally low activity in the frontal lobe, which is the area of the brain responsible for planning, reasoning, and decision making. The cytoskeleton plays a key role in maintaining the symmetrical shape and structural polarity of neurons. In neurodegenerative diseases, the cytoskeleton is abnormally assembled. Neuronal shape, loss of dendrites and spines, as well as irregular distribution of neuronal elongations occur in specific brain areas of schizophrenic patients. Neurodegenerative diseases and psychiatric illnesses are associated with the cytoskeletal alterations in neurons that, in turn, lose synaptic connectivity and the ability to transmit incoming axonal information to the somatodendritic domain. The neuronal cytoskeleton is disrupted in neurodegenerative and some psychiatric diseases.
Cytoskeletal rearrangement and Parkinson's disease. Parkinson's disease is a degenerative disorder of the central nervous system. The motor symptoms of the disease result from the death of dopamine-producing cells in the substantia nigra. The reasons for the death of these cells is most commonly still unknown. There are many symptoms relating to Parkinson's disease, with the most obvious being in the early stages: shaking, rigidity, slowness of movement, and difficulty with walking. In recent years, many studies have been undertaken to determine the onset of Parkinson's disease. One of the first breakthroughs was shown in the work of McLeod and colleagues, who described the potential role of LRKK2 with kinase activity in the maintenance of neuronal processes. They found that by suppressing the expression of the protein, that neuronal length increased. They also found that this protein has a role in the regulation of multiple components of neuronal cytoskeletal features. The cytoskeleton of neurons is extremely important to cellular function. For example, proteins that are involved with synaptic transmission are synthesized in the soma of neurons. It is the role of the cytoskeleton to transport these proteins along the axon to the presynaptic terminals. Furthermore, at a structural level, the cytoskeleton helps to maintain neuronal shape by supporting the long axons and sustaining dendritic extensions from the soma. In further studies, it was shown that LRKK2 interacts with two cytoskeletal components, most prominently actin filaments and microtubules, in addition to the fact that dopaminergic neurons are most commonly affected by Parkinson's disease. Dopaminergic neurons have very long axons, which therefore require this degree of cooperation between microtubules and motor transport proteins to ensure that dopamine is transported successfully via vesicles to transport. In defective dopaminergic neurons, dopamine starts to build up in the soma of the neuron, which results in cell death and the production of reactive oxygen species. Currently, there is no cure for the disease, but medications, surgery, and multidisciplinary management can provide relief from the symptoms, although their total life expectancy is reasonably reduced, especially when dementia and other subsequent illnesses begin to develop.